taking a conference call.
Yes.
The cameras.
We posted it. People are enjoying it.
Yes.
It was nothing bad.
Yeah, no, it's nice. People think you're.
I wasn't thinking about those.
No, no.
No.
A lot of comments on your socks. People like your socks.
Loading me.
And you were social distancing well.
There's nobody there. So really get outside, that being able to actually work on the steps outside.
It's a nice day too.
Oh,
Beautiful day.
I enjoyed the hour that I was on that conference call.
It's the first time I've heard that about a conference call.
No, but it was outside, it was just beautiful, fresh air.
How much sleep are you getting these days? Is it 3 hours, 3 or 4
I
hours?
was getting 3 or 4, but my wife completely put a stop to it and said, you're gonna kill yourself, so I'm up to 5 and 6. And
Yeah,
so we do
it makes a big difference.
Yeah, it really does. Those extra 2 hours is like everything in the world.
The country wants you to stop.
Yeah, please sleep.
Get your rest.
Okay, thank you very much, everybody. All these people have been working very, very hard today, I'll tell you. For a long time, they've been working. But before I begin, I want to express our nation's well wishes to Prime Minister Boris Johnson as he wages his own personal fight with the virus. All Americans are praying for him. He's a friend of mine. He's a great gentleman and a great leader. And he's, as you know, he was brought to the hospital today. But I'm hopeful and sure that he's going to be fine. He's a strong man, strong person. Today, every patriotic American heart beats in solidarity with the incredible people of New York and New Jersey. They've really become a very hot zone, but some very good things are happening. In New York, the first time where the deaths were less from the previous day. That's the first drop so far, so maybe that's a good sign. It could be. And the hospital levels are starting to perhaps decrease. It's been very short, but perhaps decrease. So we wish Governor Cuomo and all of the people in New York great, and New Jersey, your governor's doing a great job. He's doing a great job in New Jersey. They got hit very hard. I just want to say that the full power of the American government and American enterprise, it really is. This is an all-out military operation that we've waged, and especially over the last number of weeks. 50 states and territories have now been approved for major disaster declarations, which is very unusual. Thanks to the Army Corps of Engineers, New York City's Javits Center is now one of the largest hospitals in the United States. It's designated for treatment of the virus, patients, and staffed by hundreds of federal medical personnel deployed from 2 Army hospital units, and they're doing a great job. This was something that we didn't expect to do, but they needed help in New York, and we sent federal troops. Not only troops, we also sent a lot of very talented doctors, nurses, first responders. People are now running Javits. Also, as you know, the USNS Comfort, which is in New York, there's been a lot of publicity about that coming in, and all that was not supposed to be for the virus at all under any circumstances. But it looks like more and more we're going to be using it for that. So we'll see. That was supposed to be for people having other medical problems. But it's very interesting because there are virtually no cars on the road, no motorcycles on the road, no anything on the road. Things that would normally be taken care of, we don't see anymore. So we haven't seen that in a long time. It's perhaps a positive. But the ship is ready, and if it has to, if we need it for the virus, we will be using it for that. They'd prefer not, for obvious reasons, but if for any reason they need it, it's ready, willing and able. We have the best doctors, the best military leaders, and the best logistics professionals anywhere in the world, and we're orchestrating a massive federal response, unlike anything our country has ever seen or done. We've never done anything like this. And more we're using our medical people because of the fact that jurisdictions, states, in particular, New York, New Jersey, the Connecticut area, Long Island now has become a hotspot, part of New York. We're sending a lot of things, a lot of supplies, and now we're sending personnel where it's needed, military personnel. As of Tuesday, we'll have deployed over 3,000 military and public health professionals to New York, New Jersey, Connecticut, and other parts of our country. 3,000, and that number's going up. And we hope we're seeing a leveling off in the hottest spots of them all. So we'll see. You'll be seeing that over the next few days. Let's see what happens. But we're prepared. In the last 7 days, FEMA has airlifted critical supplies and protective equipment from every corner of Earth. They're coming from all over the planet, including from within the United States, where the equipment isn't as necessary. Since last Sunday, cargo planes have delivered almost, listen to this, 300 million gloves, almost 8 million masks, and 3 million gowns, and many more fully loaded cargo planes are right now on the way. 3 big ones landed today. And these supplies are being distributed directly to the hospitals and healthcare providers all across the nation, so that massive amount of material that we're getting in is being delivered all over the country. Tomorrow we'll deliver an additional 600,000 N95 masks to New York City to take care of the needs of the public hospital system. It was a request of Mayor de Blasio. We've been working great with Mayor de Blasio, getting him a lot of stuff. He's working very hard, I can tell you that. And we're working really very hard with New York City and with New York State. And at the request of Congressman Lee Zeldin out in Long Island, we will also be delivering another 200,000 N95 masks to Suffolk County, where they need it very badly. So we're getting that out on an emergency basis. Should be there tomorrow. We'll also be deploying millions of N95 masks to other locations that Admiral Polovchak will detail shortly. The Admiral will be up in just a couple of minutes. Over the last 24 hours, FEMA has delivered an additional 500 ventilators to New Jersey, 500. And again, the governor has been very thankful. We're working very hard with New Jersey, including building hospitals. We've also sent an additional 200 ventilators to Louisiana, definite hotspot, 300 to Michigan, working very well, I think, with the governor. Amazingly, 600 will be going or have gone to Illinois. And I mean, there's a governor, I hear him complaining all the time. Pritzker, I hear him, he's always complaining, and yet I just said, give me a list of a couple of the things we've done in Illinois. And we're building a 2,500 bed hospital in McCormick Place. That's the big convention center in Chicago. And we're helping to staff it, and probably will end up staffing it because he's not able to do what you're supposed to be able to do as a governor. He has not performed well. And we're also sending 100 ventilators to Massachusetts. So we have 600 to Illinois, we have 100 to Massachusetts, we have 300 to Michigan, we have 200 to Louisiana, we have 500 ventilators, 500 going to New Jersey. And this is being done by FEMA, being delivered by FEMA. And it's some job. Just think of that when you think about 500 ventilators. A ventilator is a big deal. We're also establishing a federal medical station in the Washington, D.C. area to help Washington, D.C., and working very closely with the mayor and everybody in Washington, D.C. At the same time, Governor Inslee, we appreciate this, of Washington State has returned 400 ventilators, which can now be deployed elsewhere in our country. So the state of Washington's done very well. They won't be needing some of the ventilators that have been sent, about 400, that's a lot. And we appreciate that he's able to give them back. He feels confident that they are in good shape for the coming weeks until we can declare a final victory. In the days ahead, America will endure the peak of this terrible pandemic. Our warriors in this life and death battle are the incredible doctors and nurses and healthcare workers on the front line of the fight. We pledge to them our eternal gratitude and everlasting support. They make all of us very proud. Our country is very proud. We have people, they love our country. The world loves our country, most of it, probably all of it. They just don't say it. I can report today that the United States has now tested and gotten results of 1.67 million people. That's far more than any other country has been able to do. And you remember we inherited a broken system, so a lot of this has been developed. By Tuesday, 1,200 brand new rapid point-of-care testing kits has been produced by Abbott Laboratories, great company, and they'll be distributed to all of our public health labs. That's a 15-minute test, even less, as well as the Indian Health Service, the CDC, and the Strategic National Stockpile. So we're going to have 1,200, and on a weekly basis, we're making a lot more. They go very fast. They're very accurate tests, and other countries are wanting them. So at the right time, we'll be able to do that. But right now, we're getting them to all of ours. So we've done 1,670,000 tests. Think of that, 1,670,000 tests. And we have a great system now. We're working with the states in almost all instances, but we have a great system. And the other thing that we've bought a tremendous amount of is the hydroxychloroquine, which I think, as you know, it's a great malaria drug. It's worked unbelievably. It's a powerful drug on malaria. And there are signs that it works on this, some very strong signs. And in the meantime, it's been around a long time. It also works very powerfully on lupus. So there are some very strong, powerful signs, and we'll have to see, because again, it's being tested now. This is a new thing that just happened to us, the invisible enemy, we call it. And if you have no signs of heart problems, the azithromycin, which will kill certain things that you don't want living within your body. It's a powerful drug. If you don't have a problem, a heart problem, we would say, let your doctor think about it. But as a combination, I think they're going to be, I think there's two things that should be looked at very strongly. Now, we have purchased and we have stockpiled 29 million pills of the hydroxychloroquine, 29 million. A lot of drugstores have them by prescription, and also, and they're not expensive. We're sending them to various labs, our military, we're sending them to the hospitals, we're sending them all over. I just think it's something, the expression, I've used it for certain reasons. What do you have to lose? What do you have to lose? And a lot of people are saying that when, and are taking it, if you're a doctor, a nurse, a first responder, a medical person going into hospitals, they say taking it before the fact is good, but what do you have to lose? They say take it. I'm not looking at it one way or the other, but we want to get out of this. If it does work, it would be a shame if we didn't do it early. But we have some very good signs. So that's hydroxychloroquine and azithromycin. And again, you have to go through your medical people, get the approval. But I've seen things that I sort of like. So what do I know? I'm not a doctor. I'm not a doctor, but I have common sense. The FDA feels good about it. As you know, they've approved it. They gave it a rapid approval. And the reason, because it's been out there for a long time, and they know the side effects, and they also know the potential. So based on that, we have sent it throughout the country. We have it stockpiled, about 29 million doses. 29 million doses. So we have a lot of it. We hope it works. Driven by the goal of the brightest minds in science. We have the brightest minds in science, but we're driven by the goal of getting rid of this plague, getting rid of this scourge, getting rid of this virus. These brilliant minds are working on the most effective antiviral therapies and vaccines. We are working very, very hard. I have met many of the doctors that are doing it. These are doctors that are working so hard on vanquishing the virus. We strongly recommend staying at home, practicing vigorous hygiene and maintaining social distance so you're just not going to catch it. It's the most effective weapon in this war. And I will tell you, we are committing to you, we're committing to the people of our country like few administrations, few people, few professionals have ever committed before. They are working so hard. I see them before my eyes, exhausted. People that I'm dealing with every day, exhausted. They haven't left their offices. They haven't left their hospitals. We meet with them. We see them. And tremendous strides have been made. I think the vaccines, we'll have a report on that, but the vaccines, working together with other countries. We're also working with other countries, many other countries. And we all want everyone else to be first. We're very happy, but we are very far down the line on vaccines. We'll see how that all works. Johnson & Johnson's doing a great job, working very hard. A vaccine would be great. Therapy and therapeutics would be great. We'll see what happens. In the meantime, you may listen to what I said about the two drugs mentioned. My administration is rapidly implementing the largest emergency economic relief package in American history. You've seen what's been happening. Billions of dollars in small business loans have already been processed through Paycheck Protection Program. So we went out on Friday, and literally it's become so popular. It's been worked with the banks. They get it to the small business. And it's all about employment. It's all about jobs. We want you to keep your jobs. Give small business funding to keep the workers on the payroll. And we're sending direct cash payments to millions of Americans and rushing aid to the hardest hit industries. We're saving industries. We will be, you'll be seeing it. And if we do more, we're going to do more, and we're going to try and get directly to people that are hit so hard. But we're going to take care of our workers. We're going to take care of our citizens. We're going to take care of our small businesses. We're going to take care of our large businesses, the airplane industry, the airline industry, a lot of great industries that we have that are in trouble because of what took place over the last short period of time. These are industries that were doing better, for the most part, doing better than ever. The airlines were doing great. Oil was doing great, oil and gas, and the energy industry was doing phenomenally well, and got hit like nobody's ever been hit before. Just about like no industry's ever been hit before. There's never been anything like this. But we see light at the end of the tunnel. Things are happening. Things are happening. We're starting to see light at the end of the tunnel. And hopefully in the not too distant future, we'll be very proud of the job we all did. Can never be happy when so many people are dying, but we're going to be very proud of the job we did to keep the death down to an absolute minimum, the least it could have happened with this terrible, terrible virus. In closing, I also want to note today is Palm Sunday and the beginning of Holy Week for Christians in America and all around the world. While we may be apart from one another, as you can see from our great churches, our great pastors and ministers are out there working very hard, but we may be apart. We can use this time to turn to reflection and prayer and our own personal relationship with God. I would ask that all Americans pray for the heroic doctors and nurses, for the truck drivers and grocery store workers, and for everyone fighting this battle. I had mentioned yesterday where I see the nurses rushing into hospitals, and they're putting on their outfits, and they're putting on their masks and goggles in some cases. They're rushing into war. They're rushing into war. And I see people from apartment houses screaming and shouting and singing their praises. It's an incredible thing. They're warriors. These doctors and nurses, they're running into buildings, and they're literally putting it on as the doors are opening. They're putting all their stuff in, running inside. And they're running inside to tremendous danger. Tremendous danger. But most of all, I'd like to ask for your prayers for the families who have lost loved ones. Ask God to comfort them in their hour of grief. It's a great hour of grief for our nation, for the world. This morning, I was talking 151. For 4 days, I said 151. 151 countries. This morning, it's 182 countries. It jumped up a lot. So as of this morning, it's 182 countries are under attack from this monster. With the faith of our families and the spirit of our people and the grace of our God, we will endure, we will overcome, we will prevail. We have learned so much. We will be stronger than ever. And I just want to thank everybody. I want to thank the incredible professionals on the task force also. We had a big meeting today. We were calls all day long to so many different people. And I think our package to get everyone working when we're ready is really turning out to be successful. We may have to make it larger because it's been really successful. But all of that comes back to this country. We want to get them back. We want to get our people back to work. Everybody wants to be back. We want to open up our country as soon as possible. So with that, I'm going to ask Dr. Birx to say a few words, and she's got some charts to show you. And thank you very much. Thank you.
Thank you, Mr. President. As you can see from the hopeful signs in Italy and Spain, where we see finally new cases and deaths declining, it's giving us hope of what our future could be. We wanted to give you an update on where all of the states were. We're looking at this as states normalized per 100,000 citizens. It looks very similar to last week. We wanted to update you. We've been covering throughout the week the states that were moving on this map. You can see very clearly where New York is as a state, although this is very much still centered in the New York metro area. New Jersey is the orange line. The green line is Louisiana. That's followed by Massachusetts, and then Connecticut and Michigan are together in those lines towards the bottom. And then, of course, Washington, D.C. is now visible on this map, which was not visible before. And the yellow line towards the bottom is Washington State. Next slide, please. So this just summarizes all of the states we're tracking very closely at the county level. So we're tracing and tracking not only the epidemic at the state level, but understanding what's happening in county by county with new cases and, of course, also the deaths. We're also triangulating that with all of the laboratory data, and just to tell you how we're kind of doing that. For New York, which you can see at the top, their serology is now about 36% positive. They were in the 40s. So day over day, their percent positive is finally starting to decline. New Jersey's is increasing, however. They're now up to 42% of the specimens that come to the laboratory are positive. Louisiana, 25%, Massachusetts, 20%, Connecticut and Michigan, 20%, District of Columbia, 15%, Washington, 8%, and then Illinois, Colorado are at about 16%. Pennsylvania, which is also new to the graphic, is at about 12%. Next slide, please. So if we could go back one, I'm sorry, we could go back one slide, one more. All of the states here, those are 38 of the states. 38 of our states have less than 50 cases per 100,000. They are testing. Their laboratory results are consistent with that. Their seropositivity rate for their laboratories are less than 5%. So this is how we're tracking and triangulating both case reporting, mortality or fatalities, and also triangulating that with the laboratory. The New York metro area, New Jersey, Louisiana, and a series, and Washington State have all tested at a rate greater than Italy and Spain. I know many of you were tracking that. Remember, many of us, we pushed out a lot of those assays at the beginning over the last 2 to 3 weeks, and I want to just thank Admiral Giroir and HHS, who's been working very closely to make sure that the states that were having an outbreak had access to all of their assays. Next slide, please. And then next one. So just to give you an idea of how we're looking at this, we look at cases every day. I want to just thank my data team. They spend all evening compiling data. I get it about 2 o'clock in the morning. And it looks at all of these metro areas by their granular counties, so we can see the counties that have new cases. That also helps us identify the hospitals and understand what hospitals will need ventilators or PPE. So this is the Detroit area. It's Oakland and Detroit, Wayne County. Next slide. We also track mortality. It gives us insight into how many clients are in the ICU and need care. We want to make sure that we're meeting the needs both on cases and really appreciating the frontline healthcare workers that are really saving many people's lives. Next slide. This just gives you an idea from New Orleans. We are now also tracking St. John the Baptist Parish also, but this was New Orleans and Jefferson County, and really tracking those on a case-by-case basis to look for changes over time. And next slide is their mortality. and you can see it's starting to stabilize. So this is how we've been tracking and tracing the epidemic as it moves through states and counties and communities. But as we started, we just wanted to note again, we do see hopeful signs in Spain and Italy. They have completed nearly 4 weeks of mitigation, with people really doing social distancing, staying at home, ensuring they were washing their hands. If they have to go out to the grocery store, they're extraordinarily careful. They send one person from the family. And so we can really see that beginning to work, and we're very hopeful that over the next week, although we'll see rising number of cases of people who lose their lives to this illness, we're also hopeful to see a stabilization of cases across these large metro areas where the outbreak began several weeks ago. So thank you for your attention.
Thank you very much. Admiral, please.
Thank you, sir. What I thought I would do is update on the air bridge first, and then follow up on Dr. Bricks and how we're geographically aligning the supply chain. So the air bridge, we had 3 additional flights come in today, bringing 1 million gowns, 2.8 million N95 masks, 2.8 million surgical masks, 11.8 million gloves, 18.6 thousand gowns on 3 flights. And that material will be pushed out across the nation, delivered to hospitals, nursing homes across the country. Dr. Bricks went through the geography, and so over the last few days, I've been aligning the supply chain to those areas, and then reaching down into those areas and extracting data from those areas on PPE burn rates. So, for example, I spent the weekend talking to the Chief Operating Officer of Detroit, Hakeem Berry, for example, then talked to the leadership at Detroit Medical Center, Audrey Gregory, talked to the health officer in Oakland County, Michigan, and then also with the Chicago health officer, Dr. Allison Arwey. So reaching down to a level to understand their needs. So we're geographically aligning the supply chain, right? So you can see Dr. Bricks went through these counties, and we're getting down to the county level. And then aligning it by priorities of point of care. Public hospitals first, VA hospitals, private hospitals, nursing homes, first responders, acute care. So over the coming days, we will be making a push to the geographic areas that Dr. Bricks mentioned, increasing the volume through the supply chain to those areas to give them weeks, not just days worth of supply. Primarily using our industry partners that we are directing, Cardinal, McKesson, Medline, Owen Minor, Henry Schein, Concordance Healthcare, directing them to put product to the hospital door, the nursing home door, the first responders, directly to them. We're also working to push out millions of doses of hydroxychloroquine, right? We are working the distribution there to push the same thing to the same impacted areas, working it to get in the hospitals and to every pharmacy. And so my team is back there right now, working the arrangements to make that to the hospital front door and primarily to the local pharmacies, so doctor can write those prescriptions and you can get it prior to having to go to a hospital.
Great job. Thank you very much, Admiral. Mike, please.
Robert Borkin, Mr. President. Thank you, Mr. President. I knew you didn't say it.
Thank you, Mr. President, Mr. Vice President. My last appearance here, I mentioned that the President had given the Department of Veterans Affairs very specific instructions to be as aggressive as possible in response to the virus crisis, and not only to protect veterans, but also to help the American people. As many of you know, we have 3 primary missions at VA. One is support veterans' health, the other is to provide veterans with benefits, and the third is memorial services. But we have a fourth mission, and that is to support the nation in times of national emergency, both in war and in peace. We provide a bridge from the federal government to the states and localities during these emergencies. As a result of that, I have ordered our veterans' hospitals to begin preparing more than 1,500 beds to make them available both at the ICU and the acute care level to the states and localities across the country. As a result of that, we have opened up approximately 100 beds in the metropolitan New York area, in Brooklyn, and in Manhattan, and East Orange, New Jersey. We will be informing the governor of Louisiana, John Bel Edwards, tomorrow that we will give him access to our VA Medical Center in Shreveport, Louisiana, to come to the aid of the people of the Pelican State. I've also given instructions to initiate the fourth mission in Michigan. We will be providing the people of Michigan access to hospital beds in both Ann Arbor and in Detroit. We've also provided a pharmaceutical trailer to be used by the governor of Michigan at Cobo Hall to support the citizens of Michigan who will be coming into that facility for medical care. We have also informed the Commonwealth of Massachusetts that we will be helping them in their efforts to protect their most vulnerable citizens in 2 of their nursing homes. So, in accord with the President's instructions, the 400,000 men and women of the Department of Veterans Affairs are in this fight. We are in the fight not only for the 9.5 million veterans who are part of our service, but we are in the fight for the people of the United States.
Thank you.
Thank you.
Thank you, Mr. President. And you all have just heard from several members of the President's White House Coronavirus Task Force, and we are truly blessed to have the kind of leadership that we have. Whether it be Admiral Polovchek, who is organizing the distribution of tens of millions of supplies, whether it be Dr. Birx and Dr. Fauci are analyzing the data literally hour by hour, or whether it be that whole of government approach that you stood up, Mr. President, calling on every agency of government, including the VA, HHS, and every agency. I hope the American people know, at this President's direction, we are sparing no expense. We are doing whatever it takes. We're marshaling the full resources of the federal government to respond to the challenges facing communities impacted today by the coronavirus, and making sure every community in America has the support. We've also, as the President said so many times, we've forged a seamless partnership with states around the country. As the President just reflected, by this Tuesday, with another 840 military medical personnel arriving in New York City, there will be some 3,000 Department of Defense and HHS personnel on the ground to supplement and to provide relief to healthcare workers, really at the epicenter of the coronavirus in the New York City area. And you just heard the VA is opening up bed space. In New Jersey, I spoke at the President's urging today with Governor Murphy. 500 ventilators announced today being built on the supplies that we have already provided. We were able to coordinate with him to extend all federal coordination on testing in New Jersey through May the 30th, if the need is there, and also opening up VA beds. I spoke with Governor John Bel Edwards in Louisiana, and was encouraged to hear from him that, as you heard Dr. Birx say, that new cases were down slightly. In fact, we're seeing a trend of some leveling among all of the governors I spoke to today. And I know what the Secretary of the VA just announced about opening up VA facilities has been a priority for Governor Edwards, but I assured him we're going to continue to send resources and supplies and personnel to support their health care. In Michigan today, I spoke to both Governor Gretchen Whitmer and Mayor Mike Duggan of the city of Detroit. Governor Whitmer and I spoke about a new program in Detroit that will make hydrochloroquine available for 3,000 patients through the the Henry Ford Hospital. They'll be tracking in a formal study the results of that. But at the President's urging, I assured her that we're more than prepared to make hydrochloroquine broadly available to pharmacies and doctors' offices across the Detroit area as they deem appropriate. I also heard from Mayor Mike Duggan, as I told you, Mr. President, and he was so grateful to the FDA, not only for approving the Henry Ford Hospital test that will be exploring hydrochloroquine, but also for the rapid approval of the 15-minute test. In fact, Mayor Duggan told me that he was able to use the 15-minute test this weekend to test 150 first responders who had been sidelined because they'd been exposed to the coronavirus. They all got the 15-minute test. They're all back in the line of duty, and the mayor couldn't have been more grateful. In Illinois, I spoke with Governor J.B. Pritzker, as well as Mayor Lori Lightfoot of Chicago. As you just heard, not only have we sent 600 ventilators to the state of Illinois, but I assured the governor, I assured the mayor that while the principal focus that we have in the next several days is on the rising cases in the greater New York City area and Louisiana, that Michigan and Illinois are in the forefront of our thinking, and at the President's direction, we're going to make sure the people of Illinois, people of Michigan have the resources, equipment, and support that they need. The governor did express great appreciation for the fact that our Army Corps of Engineers had constructed 500 beds at McCormick Place, and before the end of this week would construct another 2,500 beds for an overflow healthcare facility in Chicago. In fact, Mr. President, Mayor Lightfoot told me that the Army Corps was just outstanding in the job that they had been doing in constructing that extra bed space. As I close, let me just express, as the President did, our profound appreciation for Governor Kate Brown and Governor Jay Inslee. The state of Oregon and the state of Washington are leading by example. Oregon sent 140 ventilators to New York City. They looked at their circumstances and concluded that they could spare those at the point of the need. And because of the low and steady numbers in Washington State and in California, Governor Inslee today announced that they were sending 400 ventilators back to the strategic national stockpile, and those will be deployed at the point of the need. You know, not only are California and Washington State low and steady, but frankly, as I talk to governors and mayors today, I want to say to the American people that we are beginning to see the glimmers of progress. The experts will tell me not to jump to any conclusions, and I'm not, but like your president, I'm an optimistic person and I'm hopeful. And the truth is, we're starting to see cases and, most importantly, losses and hospitalizations begin to stabilize. But make no mistake about it, I want to say to the American people, if that holds, if that's happening, it's because of what all of you are doing. It's because the American people are putting into practice the coronavirus guidelines for America. You're listening to your state and local officials. You're practicing social distancing. You're using drive-throughs instead of going into restaurants. And so on behalf of your president and all of us, working really at every level, I just want to say thank you, America. Thank you for responding. Thank you for putting other people's lives in the forefront of your thinking, putting it again over and above your own inconvenience and difficulty. Because of your efforts, there is, as the President just said, light at the end of the tunnel. And I'm absolutely convinced, with the continued cooperation, patience, persistence, and prayers of the American people, we'll get through this, and we'll get through this a lot sooner than we first thought it would take. Thank you.
Mike, very much. Thank you.
Mr. President.
Yeah, Mr. President, if we could start with the Admiral, if that's right for you, sir. I wanted to ask you about the air gap flights, sir. There were the 2 flights that came through, the 3 flights, where did they come from, sir?
They came from Asia.
Asia, okay. And then you were mentioning all these supplies being dropped off, the masks, the gowns, the hydrochloroquine. How are you guys making sure that there's not a run on these products? You know, you drop them off at Hospital A and that people just don't rush and go grab every mask, gown. And then the question